They are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Tylenol is one of the most common pain relievers recommended to pregnant women, but the White House wants to change that over concerns the drug may be linked to autism. Some experts, though, dispute this link. This morning, we try to clear up some of that confusion. And hi, everyone. I'm Jason Newton. Welcome to 11 TV Hill. The president's announcement was anticipated, yet it's still creating a divide within parts of the medical community. The White House cited many studies, one of them from Johns Hopkins University, as one of the factors in its decision. The study published in 2019 hinted at an association between Tylenol and autism diagnoses. Meantime, the American College of Obstetricians and Gynecologists saying it is not changing its guidance on acetaminophen. It will continue to recommend that medication as first-line treatment for pregnancy pain. And joining us now is Tamika Auguste. She is OBGYN at MedStar Health. Thank you for coming by. Good to see you.
Thank you. Hi.
What do you make of all this and what's going on? I mean, it's a big change from where I think we were before when it came to Tylenol.
It is. It's a big change, and I think the message for our patients and for our fellow healthcare workers is that Tylenol is safe in pregnancy and should be continued to be used in pregnancy for pain relief and fever relief.
A word that we kept hearing, you mentioned here, association. What is the difference when you say there's an association with a drug and then something that is causal from the drug?
So when we say causal, we're saying that that drug causes that fill in the blank, that disease, that process. And association, I mean, really we're saying that there's multi-factors here that could cause that situation. And that is the case that we know with autism. Autism, there's multifactorial reasons for autism, whether it is environmental, genetics, might be something that's intake. We don't really know that there's one thing, but we do know that it is multifactorial. And so to say that Tylenol causes autism is just not based in any scientific fact.
And what you're saying, it played out in this study in Sweden. I think they had 250,000 people as part of it. Kids in the same family, lived in the same environment, mom did the same amount of Tylenol through pregnancy in two different cases. Does that play into the multifactorial?
Absolutely. Those, you have your absolute case studies there where you see everything is the same, but some uncontrollable like environmental factors could be the role here in terms of why one child may have autism, the other one doesn't.
You work in the entire system of MedStar. I'm curious, do you hear doctors saying they get questions from patients now that this advisory has sort of come out?
Yeah, I think immediately the day after the advisory came out, across our system and across the whole nation, OBGYNs were being asked by their patients about Tylenol, and we were all saying the same thing, that we continue to recommend the use of Tylenol.
Tell me about what it offers to a patient. I heard the president at one point say something, I'll tough it out, which is, for me, it's tough to hear, but I don't know. So as a doctor speaking to a patient, what is the benefit for that mom?
Sure. So Tylenol can be used for pain relief and for fever relief. So particularly in pregnancy, we want to make sure that pregnant women do not have long-standing fever, that's not addressed immediately. And in pregnancy, there are very small amount of medications that you can take to address pain and fever relief that won't affect the pregnancy. And we know that Tylenol is one that is safe, so that's what's going to stay to be recommended.
Is there a difference between a person who uses it long-term through a pregnancy versus short-term?
We don't see any evidence of that. I mean, the recommendation is to use it when needed, in moderation, and of course with discussion with your healthcare provider.
That kind of advice, does that stand for pretty much every medication?
It does. It does, right? I think that most medications in pregnancy, and pregnancy is a very protected state. We're not trying to do lots of experiments on pregnant women. We need to, but so we need to make sure that we look at the risks, the benefits, and have a discussion with a healthcare provider.
Tell me about the discussion within your office. So now how do you move forward as things sort of take shape in DC?
So the first thing is listen to the patients. They're hearing this across different media. They're hearing this come from the White House. So it's not frivolous for the patient's sake. So we need to listen to the patients, hear them, and then give them the facts, give them the data, give them the robust data that shows that there is no effect that Tylenol causes autism in pregnancy. And
if you're a patient, are there questions I should be asking when I come in? Or are there suggested things that I should think of? Let me make sure I ask my OBGYN. Absolutely.
The takeaway is have that conversation with your OBGYN provider. Say, I heard this about Tylenol. what do you think? What is the recommendation? Has anything changed? Why is this recommendation out there? Or what is the evidence to say this is safe? Your OBGYN healthcare provider will be able to give you the right answers.
And are there home resources that someone can, what do you suggest? I know the internet is, people use use Dr. Google a lot.
Right. I think it's really hard. I'm going to default to my normal and speak to your healthcare provider.
Okay, excellent. Thank you for coming by.
Thank you for having me.
Good to see you. We appreciate it.